Dr. David Orme-Johnson is one of the first and most prolific researchers on meditation with over 100 scientific papers in the field. He was the first researcher to provide scientific evidence that meditation of any kind could alter how we react physiologically to stress. He was the first to do research on meditation of any kind in prisons, showing that TM increases autonomic stability. He was also the first to show that the EEG signature of Transcendental meditation, alpha-1 coherence, was correlated with creativity, intelligence, and higher states of consciousness. Dr. Orme-Johnson is one of the principal researchers on the Maharishi effect, the phenomenon of decreased stress and improved quality of life in the larger society through the practice of the TM technique and the TM city techniques. He's published 23 research and review papers in this field. I think it might have increased. He was a co-author on the first published paper on the Maharishi effect, which showed that when a threshold of 1% of the population of a city learned the TM technique, that the crime rate decreased that year and in subsequent years. He was also the first to show that group practice of the TM and TM city program can reduce war and terrorism regionally and worldwide, being the lead author on papers published in the prestigious Journal of Conflict Resolution. And my doctoral work at Harvard followed Dr. Orme-Johnson's research, and I was looking at how the policy community evaluated this groundbreaking research. And the most recent study he will talk about a little bit today, and I'm sure that you'll be very, very interested in this. Dr. Orme-Johnson was the first to conduct an fMRI neuroimaging study on TM, showing that it reduces how the brain responds to pain. He has directed numerous major field studies, including 2 healthcare utilization studies involving 2,600 participants, and he was a consultant for 4 years on an NIMH grant to study stress reduction and hypertension in Black adults. In 1995, the National Institutes of Health Office of Alternative Medicine selected Dr. Orme-Johnson to review the research on the effects of meditation on chronic pain and insomnia for an NIH Technology Assessment Conference. Again in July 2008, he was invited by the NIH National Center for Complementary and Alternative Medicine to give an overview of research on the TM technique at a conference on meditation for health purposes held in Bethesda, Maryland. In 2011, he was invited to be a key informant for a systematic review of the research on meditation sponsored by the NIH Agency for Health Research and Quality, AHRQ, conducted at Johns Hopkins. We're very fortunate to have Dr. Orme-Johnson open the lecture series for MDED 400.
Thank you to Carla and Duncan for creating this program at Stritch, which is really historic and groundbreaking. I think if anybody needs to learn transcendental meditation for their professions, it's medical professionals, because you have a very tough job to do. And so today's talk is going to be about the benefits of TM organized according to the diagram that shows the inward and outward stroke. That during meditation, you heard from Duncan and Carla, that the mind settles down to quieter levels, and then it stirs up the stress, and then the stress comes out, and you become aware that you're thinking, you come back in. So I'm going to organize all the research in terms of that. Okay, overview of the Transcendental meditation technique, the inward and outward stroke. That's me, this is today. So the main point is that the TM technique is not a static, uniform state. It's typically a dynamical process of transcending inward to more silent levels of thought, and then coming outward on thoughts. So here's the learning objectives. These will be on the test. Review the evidence that the TM program reduces stress during the practice and outside of the practice. So I'm going to be going over that. That's what I'm going to be presenting. Review the evidence that TM increases brain integration, both during meditation while you're going on the inward stroke, and also outside of meditation is shown by increased tests of creativity and intelligence and so forth. And then discuss the evidence that twice-a-day meditation gives better results than once-a-day meditation, a dose-response effect. And we'll be talking about the theory of why that happens. Basically, I mentioned earlier that to which you give your attention grows stronger in your life. So when you give the physiology the experience of that quieter level, then it becomes habituated to maintain it out in activity. And eventually, the very sublime experience of transcendental consciousness develops during meditation. That gets maintained outside of meditation, and that would be cosmic consciousness. And I hope that Dr. Fred Travis will talk to you about that on the neurophysiology of what's happening when you meditate and what happens through long-term practice. And then discuss the theoretical basis of the benefits of the practice of TM technique and the evidence of the positive impact on national stress indicators. So I'm going to show you just one slide on the collective effects of some recent research, which makes it sort of visually very obvious what's happening. You don't need any statistics to show it. So here's the basic idea. Again, there's our cycle. Transcending goes to restful alertness, and then the outward stroke, the rise of thoughts, and stress normalization. The evidence we'll start with the stress side. The evidence that stress is reduced is, for example, autonomic stability. The autonomic nervous system becomes more stable. There's a reduction in cortisol, both during meditation and outside meditation. Cortisol, you may know, or you will soon know, is a major stress hormone. Decreased anxiety, decreased depression, decreased hospitalization. All of these things, all this is evidence that our theory that stress is being normalized is true. And on the other side, the inward stroke, where the brain is going down to subtler and more coherent levels, the evidence for that is that the brain becomes more coherent, as measured by EEG coherence. What that means is that the different areas of the brain are working together more holistically. And that is correlated with increased intelligence and activity, increased creativity, self-actualization, and eventually with enlightenment. So here we go. We're going to go through the evidence. Okay, so this is just the headings will all be the same. This is evidence of stress, and this is during meditation. So this was actually the first study that I ever did, which was published in 1973. And what I found is that meditators had fewer of these spontaneous skin resistance responses. Let's see if I can use the pointer here. So if you we're measuring skin resistance. It's part of the orienting reflex and part of this, the stress response that if there's a stressor, then your hands sweat and so forth. And if you increase the amplitude of the instruments that you're measuring, you find that people are making these small little stress responses even just sitting quietly with their eyes closed. And this is an example of it here. This sort of illustrates it, these little wiggly lines like that. And then the non-meditators, on average, showed more of these little wiggles than the meditators. And here's actually measuring the number in a certain amplitude of these responses per minute. And these are the control subjects who were matched to the meditators. And you can see that they're making around 20, 25, 30 of these responses per minute compared to the meditators who are making much fewer, like 30, maybe 10 or 9. And during meditation, it decreases even more. So that was sort of I was very excited to discover that, started reading about it, and found that all these good things were correlated with autonomic stability. Okay, so another piece of evidence that stress is decreasing during meditation is cortisol. So this was an early study by Jevening at University of California, Irvine. And what we see here is the TM group And this is baseline cortisol levels. This is during TM, and you can see that it drops down and then comes back up, recovers after meditation. The control group were people who were interested in learning TM, but hadn't learned yet, and their cortisol is basically staying pretty much the same during the experimental period and post. And then they were resting, by the way, with their eyes closed during that time. And then they learned TM and were restudied, and you can see that their cortisol is now beginning to decrease during meditation as well. Here's another example. This is actually a meta-analysis of 32 studies with Dr. Michael Dilbeck, my colleague. And looking at all the research that had been done up to that time, which was 1987, on different stress indicators that had been studied during meditation, plasma lactate, respiratory rate, skin conductance, and cortisol levels. What we were doing was comparing TM with resting. So the people in the control group are just sitting with their eyes closed resting. So if you saw two people sitting on the bench, and one was practicing TM, and the other was just resting with their eyes closed, they would look the same, except maybe the meditators' heads would be dropping like that. But anyway, but if you measure the physiology, you see there's quite a difference. That what's happening is that the level of rest that you're getting during TM is much greater than it is during ordinary rest. So lower plasma cortisol, lower respiratory rate, greater decrease in skin conductance, greater decrease in cortisol. And that's looking to sort of what is the average results of all the research that had been done up to that time. Okay, here's another example. Now this is my original study, but I was also looking at how the meditators reacted to stress outside of meditation. As Carla said, this was the first research to show that meditation of any kind can change how a person reacts to stress. So this was, in my PhD dissertation, I was interested in stress, and I was looking at stress in animal models and, basically stressing creatures and then seeing how they reacted and finding out different things about it. So did this with the meditators. And what I found is that both groups showed similar patterns of habituation. I was repeatedly giving these loud tones into the ears, 100 decibels, at sort of random intervals of approximately a minute or so between intervals. And both are showing a responsivity. If anything, the meditators are more sensitive. They're showing a greater response initially, but it habituated more rapidly than the control group. They stopped responding after about 15 trials, and the control group kind of continued to respond. Also, if you looked at the morphology of the response to the first response, the meditators made a much simpler, cleaner response like this. The control group showed these multiple secondary responses. It's like if someone's stressed, or when we have the experience when we're already stressed and something happens, and then we can kind of respond to it again and again and again like that. So TM was reducing that multiple response. So a very similar, conceptually similar idea was to look at what was happening in the brain using functional magnetic resonance imaging with long-term meditators and new meditators who are restudied. What we see here is that part of the study that looked at this is a sample of 6 subjects, and we're looking at the brain, the left, central, and right parts of hemispheres, slices. The yellow and reddish color is the areas where the blood flow increases, and which is the increase in responsivity. So this is the pre, and you see brains are all responding quite a bit to the stress. The stress, by the way, was putting fingers into hot water for a certain amount of time. which was not hard enough to create tissue damage, but it was definitely painful. And in order to get this through the institutional review board, one of my friends and I had to go in and convince the head of the review board that it was okay, So we put our fingers in hot water and we pretended that it didn't hurt, like we were being like these warrior types, that's nothing, come on, Fred, let us do this experiment. And all day after that, and he let us do the experiment, but my finger was red all day, but there was no tissue damage, it was just very painful. So it was a painful stimulus. It's the same stimulus pre-test, post-test, but look at the difference on the responsivity. The brains are responding much less, and it was throughout the pain matrix. The pain matrix, as it's called by people who study pain, is the thalamus, which is where the sensory gateway, it's where the senses come in. So that's sort of on the level of perceiving it. Yes, we felt something was there. Then the limbic system, which is kind of the emotional response, and then the cortical part of the response is what do you do about it? The action step. And all levels of the pain matrix decreased activity significantly from pre-test to post-test. And when we looked at long-term meditators, they just look like the post-test brains that you see here, both pre and post. So that same meta-analysis where we looked at stress indicators during TM, we also looked at it during outside of TM, where they're just sitting resting. And again, comparing with people who were just doing ordinary rest. So here we see the difference between the TMers or doing TM and the ones who are in the rest control group. And you can see that these are in effect sizes. They're standard deviations, which is a way to get a standardized measure when you have different measures which are in different units, like heart rate, skin resistance, lactate, respiratory rate. They all have different units. So how do you put them on the same chart? Have the same vertical axis. Well, what you do is you standardize them. This is a standard procedure in meta-analysis, and so these are medium to small effects, but very statistically significant, that the heart rates and respiratory rate, plasma lactate, and respiratory rate and skin resistance, I think I said one of those twice, are lower in the meditators just while they're at rest, just a baseline. So what this means is with regular meditation, you're going to be having a lower baseline level. Your heart rate's going to be lower. It's like a person who's in training, and a good athlete. They have lower levels of the baseline of all these parameters. And so the picture that evolved from these different studies on TM and its effects on reactivity to different kinds of stressors was that it creates a kind of ideal situation. It reduces your baseline level of stress, so you have more adaptive energy ready if you have a situation where you need to respond. So if you're a person who's stressed all the time, stressed, then some situations come up and you don't have the resources to deal with it. But if you've been calm, it's like the samurai hero. He's completely calm, and the guys are yelling out, "We're going to get you," and he doesn't respond, and then there's a time to move, and he has the adaptive energy, and he walks away. I'm thinking of a scene from Yojimbo, if you guys are samurai fans. Anyway, so that's what TM does for you. You're less wasting your energy needlessly, spinning your wheels on stuff. And it's like that, the study where with the multiple responses, something happens, okay, you deal with it, the energy's there, you deal with it more efficiently, and then you come back to baseline. Okay, enough of that, you recover. You don't keep going over and over. So that definitely is kind of the pattern that grows in one's life as they continue to meditate. And so this is another recent study on decreased stress outside of meditation. This is reduced cortisol waking response. So you'll probably learn, or you maybe already know, that cortisol is a big cycle, and it rises in the morning and it kind of gets you out of bed. It's not a bad thing. Cortisol is there to raise your metabolism and resources for dealing with things like getting out of bed. But it gets too high. If you're stressed, it's much higher. And so this is the cortisol waking response. And this is the change over time in 27 college students after 4 weeks of TM in a randomized control study compared to a control group who didn't meditate. And so they show a lower cortisol response, which is another evidence that TM and that cycle is reducing your stress, not only during meditation, but outside of meditation and how you react to life. So going into the psychological domain, this was a meta-analysis comparing TM with a wide range of different relaxation and meditation techniques, including placebo controls. And the control groups, this again is in effect sizes and standard deviation, the control groups are all showing effect sizes around 0.4 or less, which is a moderate to small effect size. And the TM technique subjects were showing a large effect size. An effect size of 0.8 or greater is considered to be a large effect. A large effect means that if it was like a treatment, you were a doctor and you're treating someone and you wanted to know, is this particular pill going to improve over standard care, then an effect size of 0.8 would be high enough that you and the patient would notice something. An effect size of 0.5 would kind of indicate, well, it seems to be a reliable effect. But 0.8 was, this is really something that makes a difference that you would notice. And so here we see a meta-analysis of 97 studies on the effects of alcohol use, TM on alcohol use, compared with other kinds of treatments for alcohol. Peer influence, relaxation techniques, driving under influence programs, preventative education does very little. You give out pamphlets to people and say, don't drink, it's bad, and give all the reasons why, but that doesn't affect behavior. Peer influence has some effect, having your peers who've gone through it, like an AA, for example, program, can be effective. But TM was more effective, and it's just because the regular meditation is normalizing your physiology and the stressors which are causing people to self-medicate with alcohol. So drug use of all kinds, uppers, downers, it's basically an attempt to get into a more ideal physiological and psychological state. So if you're feeling stressed, you take a downer or a relaxant. If you're feeling depressed, you take something that increases the serotonin availability, for example, which you take an upper. So you're always trying to titrate. The body and the mind is always trying to go to a more ideal state. You're feeling too excited, you want to quiet down. You're feeling too quiet, you want to liven it up like that. And TM, by doing that automatically in meditation every day, regularly, then you're more likely to be in your more ideal state and less likely to reach for an upper or downer. So, same thing with drugs. This was a meta-analysis of 70 studies looking at TM compared with peer influence and preventative education. And so here's a study that shows how broad the effects of TM on stress reduction. This is a study of medical care utilization that I did on 2,000 TM practitioners over a 5-year period. And what I found was reduced hospital admission rates in all categories of disease for TM compared with normative data and compared with matched controls. So when I first submitted this paper, I just had the average result, which was that TM reduced hospitalization about 50%. Also, doctor visits or outpatient visits, it also reduced. I didn't show that in this slide, but I'll show in another one. So the editors came back and said, well, that's interesting, but probably it didn't have any effect on serious diseases, maybe fewer runny noses or something like that. So thanks to the editors, I expanded the study to look at all of the categories, and much to everybody's surprise, TM was found to significantly reduce medical care utilization in all categories. TM is the blue. Then there was a question, well, maybe the meditator group is younger, because medical utilization changes with age. So I looked at different age categories. And so again, the red bars are the normative data, the blue bars are the TM group. And so in the kids, 0 to 18, they had about 50% fewer hospital days than the normative data. In the 19 to 39 group, they also had about 50% fewer. The older ones, in this case over 40, which is for me, that's less than half my age, but anyway, they were 69% fewer hospitalization days. So this really shows the anti-aging effect of TM, that age usually goes up medical utilization goes up with age, as you see with the control group. That's the normal thing. And it is going up a bit with the TMers, but less steeply. And then looking at doctor visits, which is outpatient visits per 1,000, the same kind of pattern. This is 0 to 18 years, 47% less with the TMers, 19 to 39%, or 55% less. But the older ones, over 40, were 74% fewer outpatient visits. And there's a lot of research showing that TM slows down aging, and so get started early. So now let's look at the inward stroke a little bit. Evidence of increased integration of the brain during meditation, and what we found early on was increased alpha in a particular frequency band, slow alpha, which was 8 to 10 hertz. And this just illustrates what the EEG looks like. It's very rhythmical. You can see that this is from different parts of the brain, and the frontal going back to the posterior parts of the brain. And you see very, very similar wave functions there. And if you mathematically calculate coherence, which is the stability of phase angle between the different frequencies, you find that there's very high coherence in this frequency band. And what does that mean? What it means is that it's correlated with creativity and all of these different things, practical intelligence, field independence. This actually is a study of randomized controlled trials that one of my PhD students did in Taiwan, and on 3 different schools, over 300 subjects, and found the same thing in all the schools. So this is the kind of average effect size from all the studies. Interestingly, the biggest effect of TM was on creativity, and next on practical intelligence, and then on field independence. Field independence is like ability to find a needle in a haystack. A field independence test gives you some target you're supposed to find, and then it gives you a very complex background field, and you have to see if you can find that. It's like there's little kid games, that you see in magazines that have that. Find the owl. Where is the owl? Or where is the apple? Or where is something? And you have to find where they're located. So that's what field independence measures. But it's really quite profound because it's measuring the ability to hold that thing in mind, what the target is, in focus, at the same time not be distracted by the background. And studies have shown that people who are field independent, for example, are more independent of being socially influenced. The social psychologists do studies like they have, say, 3 different stooges who are going to try to influence this person. And the task is that they're supposed to say what they think a reading on a dial is. And so the field independent person is much more likely to stick to what he or she sees, yes, this is how I see it. And then the stooges say, no, I think it's like this, I think it's like that. Aren't you sure you see it like that? No, it must be like that. It's like ability to withstand fake news, basically. And so you get better with that, with TM. And also mental efficiency was a computerized test with reaction time test. And that just showed that the decision-making process, you have to decide go, don't go, was much faster or increased with learning TM. And then fluid intelligence is that aspect of IQ, which is the ability to solve problems in novel situations. You don't have any background knowledge about it. There's nothing in the books that trains you for it. Some situation comes up, then you have ability to figure it out. So that's what fluid intelligence is, and that increases. And which is really remarkable because the research in the field has shown that pretty much nothing increases general fluid intelligence. You know, if you train people on a specific thing, a specific task, they get better at it, but it doesn't generalize to being better at sort of all sorts of things. So this is looking at more psychological, holistic measure, which is self-actualization. This was another meta-analysis. Self-actualization is, a self-actualized person has all sorts of positive qualities of being like the best version of humanity, but also maintaining their own cultural traditions, but being open to other cultural traditions. The idea of it came from Abraham Maslow, and everybody in Maslow's generation was studying pathological psychological states, schizophrenia, depression, all those things. But Maslow noticed that one of his teachers, Ruth Benedict, he was an anthropologist, was really different from other people. She was so positive and open and so inclusive and so brilliant, in her ability to make associations. And so he started studying that, and he had the whole idea of self-actualization, and everybody is growing towards self-actualization. And we would extend that to, say, enlightenment, and we have extended it into the area of enlightenment in some of the papers. But anyway, so this is using a standard measures of self-actualization, and TM increases self-actualization more than other meditation and relaxation techniques. So here, just to summarize, going back again, what is the evidence for the outward stroke, releasing stress or normalizing stress? And autonomic stability is an example, reduced cortisol, reduced anxiety, reduced depression, decreased hospitalization. Those are some examples that I mentioned. And then on the inward stroke, increased coherence during transcending, increased brain integration. That's shown by EG coherence, increased intelligence, increased creativity, increased self-actualization, and increased enlightenment, which I didn't talk about. So now I want to go just quickly through the science behind why meditating twice a day is better than once a day. And during meditation, we found that the brain becomes more coherent than it does outside of meditation. And this is illustrated by the EEG with your eyes open. Generally, the alpha wave is completely inhibited when your eyes are open. And when you close your eyes, then you'll see this, and when you're practicing TM. So the idea is that with regular meditation, then you have high coherence even with your eyes open. And we have, a lot of studies showing this. So here are some studies, that show examples of the difference between those in the study who meditated regularly versus those in the study who meditated irregularly. So this was study was on heart attacks, strokes, and death. And the regular meditators had 66% reduction in events. So these are not trivial events. This was a long-term study, went about 10 years. The people in the study were people who were coronary artery disease patients who had different events already. And so what was found was, but Dr. Schneider and his colleagues, is that if they meditated regularly, then you had a 66% reduction in events. Irregular, you got a benefit, but it's only 50%. So here's another study that was done in Holland. It looked at two different measures. This was a study went on for over a year, and this one compared the group that meditated more than twice a day, which is on the left-hand side bar in each side, or those that meditated more than twice a day. So on intelligence, okay, the increase in intelligence, you can see, was much greater. It was statistically significant greater in the group that meditated twice a day compared to those who meditated once a day. And he also measured somatic neurotic instability, kind of neuroses, and found even a greater difference between them. The meditators who meditated less than twice a day showed a fairly small reduction in somatic neurotic instability compared to those who meditated more than twice a day. So I thought this is very interesting that TM seems to have a stronger effect right away on emotional kinds of variables like this neurotic instability. People began to be sort of emotionally more normalized. And intelligence, which is hard to change, changed more slowly. And we saw the similar thing with the study that measured creativity and intelligence and all those different variables. Well, creativity, which is really related to the feeling level. If you're feeling relaxed in yourself and at home, sort of mother is at home feeling, Marcia used to say, then you're very creative. When the mother is at home, the child is running around playing and so forth. If the mother's not there and the child's all fearful and kind of shrinks, the creativity is not there. So it's like that within us. When we're meditating and we're feeling more comfortable within ourselves, then we kind of overflow with creativity. And so this is showing another aspect of that, is that the sort of neurotic feeling is decreasing much more rapidly. But anyway, the main point is, if you do it regularly, you get better results, whether it's intelligence or somatic neurotic instability. Then this is another one. This was actually done with kids, and showing a measure of resilience. And those who meditated twice a day got twice the increase in resilience on a resilience scale than those who meditated once a day. So TM is a valuable evidence-based tool for stress reduction and clarity of mind, and for developing enlightened physicians and an enlightened world. So this is the world you're going into, so you need to meditate twice a day. I just want to tell you one more thing, and that is that we're all connected. You probably are aware, and maybe you have had experiences of sort of direct connectivity where your mother knows what you're doing, or you know what your friend is doing, or someone you love, or your twin, or depending on your situation. And we're connected, and there's different levels of collective consciousness. There's family, there's a family unit, and then there's the community, and you're connected to the people in your state, and then your country, and then the whole world. So everybody's influencing everybody through these interconnectedness. And so when we become more coherent, less stressed within ourselves, our contribution to that collective consciousness becomes less stressed and more coherent. So it's, there's been over 50 studies now that show that if you have a sufficient number of people meditating in a community, it will reduce stress indicators like crime rate and so forth. Let me see if I put an example there. Yeah, so this was the very first study on this, and it was looking at, this was in 1975, and got published a couple of years later, that cities after they reached 1% of their population practicing TM, that the crime rate decrease. This was 11 cities, small cities in the US, compared with control cities, which were in similar geographic region and had similar demographics, which crime rate continued to increase overall. The average result was an 8.2% decrease in crime rate in the 1% cities and an 8.3% increase in the control cities. So about a 16% difference between the two, which is highly statistically significant. And since that time, there have been 50 different studies, different variations on this, and getting more cities and looking at a randomized sample of all half of the urban population of the U.S., showing the same thing. I'm just telling you about it, but I want to come to one sort of recent study. And the background on that is that we have these golden domes. There are meditation domes at Maharishi University of Management. It says it's actually Maharishi International University again. I should have changed that. And this is going to be a study of what happened on the quality of life in the United States from 2003 to 2016. And here is a group meditating inside the dome. And one of as an experiment, we wanted to increase the number of people in the dome to a number that would have a predicted effect on the entire United States, and that would be the square root of 1% of the US population. And research had shown that the square root of 1% of the population practicing the TM technique in a group has a positive effect on the whole society. How can so few have an effect on so many more? It's just the Jim was talking about the oxen pulling together. It's just the effect of when you pull together, it's a general principle that the effect of coherent elements in a system is proportional to their numbers squared, whereas the effect of the elements in the system that are not coherent is just proportional to their numbers. So you get this squared effect, and we can talk about that if you're interested. But here was the study. What we see on the vertical axis is the number of people per month on average over the years 2000, 2005, 2010, 2015, and you can see that during the baseline period here, the number was around 500, and it was dropping down around 2005, and then around 2006, the number of people meditating together in those golden domes shot up, and it was due to a grant of a donor who provided stipends for people to come and meditate and help pay their housing and food so that they could have time to participate in this program. So we had the experimental period here where the numbers had reached the square root of 1% of the US population at that time, which was about 1,725. That's this dotted green line here. So you see the numbers come up over this dotted line. So the experimental question here is, what happened when the numbers reached 1725? What happened on stress indicators, which I'll show you in a minute. And then in the post period, when fundings were lost and the numbers dropped down again, and part of that was due to they brought 1,000 pundits from India who were practicing not only TM and the TM City program, but very powerful Vedic technologies which are predicted to have a coherent influence on the collective consciousness, the Rudra Abhishek. So the question was, if you turn the dial of the coherence up, what happened? Can you see it in the data? And then when you turn the dial down again, suddenly the coherence drops, particularly in this period around 2013. What happened to the indicators? So I'm just going to show you a little bit at a time. So this is the baseline, and what we're measuring here is the blue line is the size of the MIU group. So here you see this is an annual data rather than monthly data, but you see it's around, and it's in standard deviation units, so you don't see what it's around, but it's around 500, then it shot up to 1,700. And then these different colored lines are the different indicators. The red line is the average of all of them, but we have murder, rape, assaults, robberies, infant mortality, drug deaths, vehicle fatalities, and children deaths by injuries. This unusual one is drug deaths, the drug epidemic, people dying from overdoses, which was increasing. But you see the other variables are pretty flat on there. They're not changing much. And then, so what happened during the demonstration period, as the size of the group reached the threshold, the blue line, you see that all of them simultaneously began to decrease. You had decreased murders, decreased rapes, et cetera, et cetera. And this went on drug deaths, which was increasing. It also decreased, but it flattened out. The angle of the change in the slope was about the same as the other variables. It's just that it went from increase to flatten out as from flatten out to big decrease. So then, okay, what happens when the numbers were decreased again? So the blue line shows the drop in the size of the coherence grading group. And at first, what you see is there's a slowing down of this drop in all of these stress indicators. They're not dropping as fast, but they're still dropping. But then, particularly when the numbers from 2013, 2014 begin to drop precipitously, when our Vedic pundits went back home, and then all the stress indicators increased very steeply again. So here we have in one visual, simple picture that doesn't need any statistics, it shows this effect. So the question is, what are the alternative explanations? So we looked into, everything that was known about these different variables. Like, for example, crime rate is influenced by economic variables, like unemployment. So more unemployment, more crime. Well, unemployment was very high during this period, and there's a whole story about that. Why didn't the coherence reduce the unemployment? But the short answer is that the economic sector was basically evil at that time, or they were greedy, you could say. It was the dot-com, not the dot-com, the prime mortgage debacle, when all the banks went broke and so forth, because they had all these lending policies which are not sustainable. They were giving money out to people. They weren't checking whether they actually could pay back, and so and the whole thing fell apart. And so, but anyway, unemployment was high, which would predict increased crime, and yet crime came down. And it was a big puzzle. People who followed crime say, why is this happening? This is unbelievable. It's the opposite of what we usually find. Another thing that influences crime is the number of people who are in prison. Well, it was during this period that there were more people released from prison than usual, and yet crime was going down rather than up. Usually you let people out of prison, crime goes up. It didn't this time. And so forth. So none of the different things that could predict changes were changing in the right direction to show this, much less changing in all of them simultaneously like that. So it's what we're trying to do is to create one large group for the world. Actually, this is what we've been trying to do ever since the beginning of Maharishi started teaching TM in the world. He's been creating groups in various ways around the world. And that's what we're currently trying to do, is to create world peace, to stop the war in Ukraine. And what we want is Vasudev Kumbhakam, as it says in the Manu Smriti, which is part of the Vedic literature. The world is my family, and we want world peace. And this is the 50th anniversary of my paper on autonomic stability. So this is me talking to Maharishi about my study. And Keith Wallace, who was the first to look at the physiology of TM, published it in Science in American Journal of Physiology in 1970, 1972. And Maharishi is very interested in the research, and he really wanted to bring it out to the public. And so we started creating these chart books, these simple charts that would explain the research but be accurate, and so that was sort of what I did with my life. So that's it. So here's the learning objectives. Review the evidence that TM reduces stress during the practice and outside the practice. So what will be some evidence? You guys can talk for a while. Or if you have any general comments. Yeah, you might consider in your own experience, in fact you already gave some examples, some beautiful examples when talking to Carla, of anything that you've experienced so far that would illustrate what some of this research is found. What have you found in your own experience? And so one of you said reduce stress, less stressed about so many things, and that's very basic. So that's what the research shows. And some of you, you'll probably find that it'll be easier to learn stuff. I don't know if anyone's noticed anything like that so far. How did you do on your test? Of course, you just started meditating. But.
So the point is, so as we talked about from the very, very beginning, if you look at those particular objectives, we talked about we don't just meditate for the experience during meditation, but for the benefits outside of meditation. And we showed you some of the scientific research on what those benefits are, and I think it probably parallels your experiences as well. Particularly the brain integration, which is why you're going to be fabulous doctors, so when you take care of me someday, we'll know what that is. The other pieces that hold dose response concept, that's sort of a medical term that when we double the amount of medications, we usually see twice the response or some dose response curve.
Unless it's an overdose. So it's got to be the right dose, yeah.
We have one down. That decreases as we saw, overdoses went down. But that whole idea that practicing twice a day is better than practicing once a day. Practicing once a day is better than practicing nonce a day, but twice a day is really what's optimal for you guys. And the other piece is, even with the 1% studies from a population perspective, this is your population. So getting together in a group, and you've already figured that out for yourselves, getting together as a group and meditating together as a group is much more powerful than doing it individually.
Yeah.
So it's sort of like drafting off each other when you're in, some of those races. So take advantage of the fact that you've got a group of folks together and meditate together whenever you get a chance. It's a very supportive environment, and you'll really be benefiting yourself and your fellow students as well.
And everybody these days is wishing for world peace, and no one wants more war. I thought we were over it by now, and so every time you meditate, you could feel you're really doing something. You don't have to feel guilty that you have to go out and carry placards or something, and you may want to do that too, or different things you can do, but you are having the best influence is to create peace within yourself on all different levels, to create peace in the world, because we have that connectivity with everybody.
The UN has a plaque in front in New York City. All war starts within the mind of man.
Yeah.
Well, I think this has been very empowering to know about your own, what can happen for you and also for the world. And at some point, if somebody wants to help organize this, we could have a lunchtime talk with Dr. Orme-Johnson about more about this research that he's talked about in terms of the effects of groups, if you'd like to hear more about that. And I'd like to point out that you need to fill out or complete a 1-month reflection, and you go to this website, which is the class website, to complete the reflection. And we're meeting on September 18th again, and thank you so much for coming. We love being with you. Thank you immensely, Dr. Orme-Johnson, for making the trouble to come here and talk to us.
So what time is the lecture on the 18th?
The 18th with Dr. Carroll will be at 5 o'clock for the group meditation and dinner following like we did
And
tonight,
it will be in this room?
in this room.